Welcome to On the Level, broadcasting from the Blue Ocean Network studios here in Beijing. My name is Fergus Thompson. Now, for several decades after the Communist Party came to power in 1949, healthcare indices in China improved massively, particularly in areas such as life expectancy and infant mortality. Ironically, however, as the country opened up to the outside world and the economy boomed, the healthcare system did not. In response to this, and in response to some public disquiet, in 2009, the government launched much-hyped healthcare reforms, and these reforms have been in operation with mixed success until today. Well, to discuss the state of healthcare in China today, particularly those reforms, I'm delighted to be joined by Zhang Wei of Peking University Guanghua School of Management. Dr. Zhang is a trained surgeon. He also has a PhD from Harvard in healthcare policy, and he is a recognized authority on healthcare policy management in China. Dr. Zhang Wei, welcome to On the Level.
Oh, great pleasure to be here. Thank you.
Now, just to give people who may not be aware of the situation in China some sort of a background, perhaps you could run me briefly through what I mentioned in the introduction there. Healthcare in China from the 1950s until where we are today. What has the process been?
Okay. I think the China healthcare has been dramatically changed in the past 60 years or so. Starting from early 1950s, when China is just as poor as we can imagine. China is building the infrastructure with support of the government. And then over the following 2 or 3 decades, I'm sure most people are familiar with the term barefoot doctor.
Yes, yes.
You know, that's a very unique China form of solving the solving the medical need in the rural area by offering quasi-practitioners who have minimum treatment, but who can offer effective, timely care when people have some minor disease. So that's how things went until the end of Cultural Revolution. After the Cultural Revolution, there'll be something like around the early 1980s. You know, as with the collapse of the commune, at the meantime, so did the community healthcare service in rural area. So the barefoot doctor and commune were gone at the same time. So all of a sudden, the healthcare system in China became very fragmented. There was limited resource to provide basic service to people who are living in an underdeveloped region. So that was kind of the second stage. You know, when China trying to embrace the market, the healthcare somehow get lost. The third stage is starting about 20 years ago. You know, Chinese government say, well, maybe we could encourage China hospital to be a little bit market friendly. So they implement a policy where hospital can make profit on drugs. They have 15% markup. So not surprisingly, we have been selling lots of drugs with that policy to cover the financial need of the hospital and the doctors. And all this become out of control and become the attention of public outreach around 2005, when one of the government research reports said in public that healthcare system was collapsing. This was very rare in the China context, that a government think tank openly saying the healthcare system was collapsing.
To make an admittance of that magnitude and say things are really this bad.
Yeah, they use the word collapse. It's not success, it's just collapse. So that following that research or following that public admittance, starting in 2009, China became the first comprehensive round of healthcare reform. So this is a stage we talk about with lots of new government funding, with a mixed result, with rising public expectation, and meanwhile also creating lots of new business opportunity, as we can say. Right.
So this is where we are today. This money was invested in this public health care reform in 2009. That program is still ongoing. But before we look at that in a bit more detail, what is the experience for somebody who is going to deal with the healthcare system in a hospital? Effectively, it's in hospitals in China. What is it like for the average person going into a hospital?
Well, you know, in China, it's very hard to describe average person. And let's say, first by economic status. If you are poor, the problem is economic burden will be huge.
It's going to cost you more than you can afford.
Well, it's the uncertainty of catastrophic cost that's really going to haunt you. And that creates many issues with access. And so for the people who don't have economic means, the affordability is a big issue. However, for people who are middle class, upper middle class, their complaint is, first, healthcare is not cheap, but their primary concern is the experience was pretty bad. You know, for them, getting to the healthcare or getting to a hospital is like traveling back in time at least 20 years. But if we change this category, let's say, if we look at disease perspective, for patients who have, let's say, a trauma or a catastrophic event who need immediate attention in cities, most likely he can get a world-class care, and the outcome would be good.
If they have the money to pay for that care.
If they have the money to. In terms of technology, in terms of some of the outcome measure, China was world-class. However, as a disease is moving from acute disease to chronic disease, for patients with diabetes, hypertension, or who just want to improve their livelihood, for them, for the people with chronic disease, their experience was fragmented and very much spotty, in that they may have one or two nice experience on 1 or 2 days, but most of the time is far from their expectation.
So this healthcare reform, the aim of it is to, in some cases, well, presumably to address this, and as I mentioned, it began in 2009. What are the main goals and what has been done so far?
Well, if you look at the overarching goal, objective is very clear. It's about safe, effective, convenient, and affordable. Those are the 4 words they put on the outline. Those are the overarching beacons for the whole healthcare reform. Sounds very good. It reminds us of the term value for money. This is what we should be aiming for. But the challenge is, if you look at the 4 words, 3 of them are not measurable nowadays in China, like safety, effectiveness, or convenience. The only thing measurable is drug price. So as we said, you get what you measure. If we set up a game with limited ability to measure, there's very limited ways we could improve. So I would say the goal is great as a world class, but in reality, different institutions are picking up the measures which they deem convenient for their own sake. A little bit background about the Chinese system. Chinese system is dominated by what we call public hospitals. Public hospital control over 95% of the hospital bed and over 95% of the volume of inpatient and outpatient service.
Right.
So they are the really big players in there. But the challenge is Chinese public hospital is public only in name. Typically, government funding used to cover about 1 month of the staff salary, which means there's a huge financial gap.
So who is paying for what these hospitals are providing?
Exactly. So facing that dilemma in the old system, and before the kickoff of the reform, the hospital have to find ways to narrow the gap. So one source will be social health insurance. That can help a lot. Another source will be, as I said, China has an established policy we called 15% markup on drugs sold in hospital. So in Chinese public hospital, pharmacy, prescription and the drug dispensing are not separate. So if the hospital can legally make 15% markup on all the drug they sell.
Right, so they're going to sell as many drugs as they can because these will make money and they'll be able to pay the doctors and pay for the upkeep of the hospital.
While this may fit the interest of some players of the industry, but this is bad news for social health insurance.
It's probably bad news for the patients as well.
For the patient is, so the first dilemma is they don't know where to get the payment to afford this. Second is once they can afford this, they face a dilemma of whether this is appropriate or not.
This shortfall then, which is made up previously up until 2009, how is that addressed by the healthcare reforms?
In the 2009, the government I think the good news for the last one reform in 2009 is this is not a policy issue, this is a political issue. Now, once we want to solve the problem, health insurance is something very new, but it's crucial to China. This is why they have that new job for Ministry of Social Security, but historically people think health and healthcare is a job of Ministry of Health. But I would say Ministry of Health do not have an excellent, strong record in delivering effective and convenient healthcare service to the public. So people's trust tend to be low in that regard.
So in terms of getting that trust, what the idea of these reforms is that they will make healthcare affordable and accessible to more people, as you said, with safety and those other terms. How are they doing? A research from Horizon Consulting recently, in 2013, found that 80% of those asked said that access to healthcare was still difficult. 60% actually said it was more difficult than in 2009, and 87% said that they found it more expensive, even though healthcare insurance has, in theory, been boosted from something like 30% to the high 90s. Why are these people coming out with this really rather sort of negative attitude towards what's happened so far?
When the reform started, the government pledged hundreds of billions new funding into the healthcare sector. And some of this funding is going into the health insurance premium. So in general, people's expectation was, with such a flow of new additional funding from the government, things should be solved. China is not a poor country. We have the money to solve these issues.
Yes.
And meanwhile, all the satisfaction is what I call relative. China has the world's best high-speed train. If you look at it around, many things become world-class or even world-leading. But in healthcare, despite the progress that hospitals, government is making, people tend to compare healthcare experience with the experience in other sectors. This means healthcare is making progress, but unfortunately it's not as fast to catch up with the other sectors. That's the first perspective about the public expectation.
Right.
Second, regarding insurance, China's already covered more than 99% of the population, somehow covered by one type of another, this government social insurance. But the tricky part is, first, China does not have a universal healthcare insurance, which means we never have a national insurance. All the insurance is risk pooled and financed and managed at the local level. Means a city like Beijing, Shanghai would be an outlier with tens of millions of enrollees. But they can be a small county with just 10,000, 20,000 enrollees, which make risk protection very, very difficult. So first, every health insurance in China is local. It's fragmented.
Does this also mean that you have problems if you move to another part of the country?
Exactly. That's the next issue. It's not portable. I have insurance in Beijing. If I move to Chengdu, other cities, I feel sick, I'm in deep trouble in terms of getting reimbursement and getting everything. Third issue is this is local, it's not portable, it's fragmented, premium tend to be low, but raising very fast. The biggest challenge is Chinese government has limited experience in managing health insurance. Western medicine has been in China for over 100 years. It's well practiced, it's world class. But China's experience with managing health insurance is probably only no more than 15 years. As in many aspects of China can have a great fund, have a great technology infrastructure, but once we come to soft infrastructure as management, China remains a student too. Yeah.
You mentioned, or we have been mentioning hospitals a lot in this, and that is the experience of somebody who has a health problem in China. You go to a hospital. There doesn't seem to be what exists in many countries, a primary healthcare system. In the States, it's the family doctor, the GP perhaps, where people go and are assessed, and they're a gatekeeper, and they're told, yes, you have something serious, I will refer to you to such and such a hospital. No, I can treat you here. Why is that missing here in China? And is there anything been done to set up something like that?
Yes, I think you are touching a very important issue in this sector. First, on the supply side, Chinese medical education is best described as a song, do re mi fa sol la si. We have doctors who are trained as US doctors, like a graduate from Peking Union Medical College who follows American system, 8 years until you get a PhD. But in parts of China, a doctor can get his license after 2 years of training. So now doctors in large teaching hospitals in the big cities are pretty good. However, if you go to the rural area, the option is whether to have an underqualified doctor or have no doctor at all. So these become a big issue. In general, every doctor, if they can, they want to work in large teaching hospitals to become a specialist. For economic reasons, also for reputation reasons. So we don't have enough competent doctor to do international medical practice. And the most of the competent, nearly all of them, want to be a specialist working in large hospital instead of community center.
So anybody entering this system of the general practice or family medicine, it's considered low status, presumably it's low pay?
Low status, low pay, and from the professional perspective, the profession needs volume, patients' volume to perfect their skills. If you are a large teaching hospital, you can do many, many more procedures than if you are just a GP in a community center. Second is on the demand side. China's hospital system was built after the Soviet Union system, somehow following the logic of planning. Here's one city, let's move 4 hospitals in there. Right. So when this was built, with the introduction of new technology, people think it's kind of privilege. It's kind of nice if I can go directly into the hospital to take care of my illness. So nowadays, when the family or when the young parent have some issues, their first reaction is, let's take the kid to a hospital because doctors there are well trained, is better, and there's great technology in there, and I'm willing to pay.
But the result is when you go to one of these hospitals, it's like a circus. There's people running everywhere. It's crammed. People have tickets. Doctors
it's like airport before Thanksgiving.
Yes, except this is a problem. You recognize it, and I'm sure the government here recognizes it as well. Is there a solution to this problem?
The solution is, I think, one hope is coming from health insurance. One way they can do is, if you go to community care, in some cities, I can reimburse your outpatient visit up to 90%, 90. If you go to general hospital for outpatient visit, I reimburse you just like 55 or 60%. They use this co-payment to steer the flow of patients, right, which has been proven effective in some cities. However, in China, what's interesting is people are using some of the cell phone app to do some of the primary care service, like checking their blood sugar, having some consultation. So that's one thing. Technology might be a disruptor in the model of China's primary care in the near future. Second is China has 3 tiers of hospitals. 3rd tier is really good. 1st tier, however, tend to be empty. They have no choice but somehow to converting themselves to a primary care institution to meet the needs of the public.
There has been talk also amongst these health reforms of bringing in more the private sector, whether that be the Chinese private sector or recently from 2012 it's been possible for foreign partners to play a part in this. How do you see that? Is there a profit to be made? Are people going to be interested in coming and investing money in a healthcare system, in a hospital in China?
First of all, I think I'll say the best news from last round of reform is the realization that public sector cannot achieve the job alone. To me, that's the biggest learning from the last 5 years. When they started the reform, they trust public institution, but it turned out they failed to meet the public expectation. Now, if you look at the wording of the Chinese policy, they started with allow private, they use the word social investment. Then the word become we encourage. Then the word become we strongly encourage. So this shows China needs very much like a mixed model. If public sector dominate the healthcare sector, and they have their old ways of running healthcare, I think the best way to shake the system is to introduce new players. With that, they put the number 20% of hospital bed should belong to private sector by 2020. To me, I can bet the number is going to be more than 20%. Because in China, policy is very often symbolic. It's a symbol that we are not opening the door. Once the door is open, the more competitive force will come. They can somehow find their own ways, be more efficient. It's very likely it's going to be more than 20%.
The trust of the public is something that comes up not only in terms of the healthcare system, but also in terms of doctors. There are figures of actual assaults on doctors, 10,000 in a year, and according to one. And this, it may be that the doctors are forced into this, but what is behind this extreme frustration on the part of patients, and what are doctors doing in some cases to deserve this form of respect? Is it because they are, as many people see it, making money on the side, encouraging people to pay more than they have to? It seems to have become a profession that used to be highly respected and has gone to the opposite end of the spectrum.
Yeah, I think that's really a tragedy. The evidence in multiple surveys are showing Chinese doctors, majority of them are unwilling to send their kids to medical school if they could afford. which is the opposite of the majority of the world. I think regarding this patient's violence issues, I think starting from the patient side, they are facing dramatic economic pressure, and navigating the system is not very smooth because it's no primary care. There's no one to navigate, to help you navigate.
It's frustrating and complicated for anybody who has to face
and
it.
it's very expensive. And the experience is not ideal, it's far from ideal. So that's from the patient side. And also, on the provider side, I think the challenge is medicine used to consider a technical task. It's not considered an experience. So when the technology was not there 20 years ago, it's okay to say it's about technology and the use of technology. And I can also generate revenue on that. You know, it's a win-win situation. Now, once technology itself is not as exciting as it was 20 years ago, when the new technology was nothing new to most of the Chinese public. People came to the hospital for a great healthcare experience. But it just happens, established institutions and established doctors are not used to offering experience. They still focus on the technology. But meanwhile, this technology is getting more expensive. So people can say to the providers, you are getting the money, you are using more expensive technology, but my experience is not catching up.
So you're saying
all those frustrations build up to the moment then people can get violent.
So if the patients, to put it simply, were treated better, many of these incidents might be avoided. It is simply to do with the way that you are sometimes blocked off or told, don't go to this line, go to this line, and then you go there and you're told somewhere else. It can be extremely irritating for anybody who's going in.
Exactly.
If they had a better experience as if they were going to a business, a restaurant or a hotel, and people were nice to them, that it might be a different story.
This once again comes to my argument, you know, healthcare is a policy issue in China, but it's more and more become a management issue. Now, when the hospital is so busy acquiring new technology, building new facilities, they should do more in training doctors or the staff to offer effective or friendly service. Some private hospital is going in that direction. You know, they position themselves as, you know, we offer good experience, we make you satisfied, we give you respect. Well, most of the public providers still think I'm kind of on top of the technology, I'm the best player for this procedure. So one is focused on technology, one is getting more on the experience. So that's why I see there is huge potential for private hospitals to meet the need of providing a decent service to the public.
That's the service the patient gets when they get into the hospital and when they can afford to pay for it. Another aspect which is often covered in the media here is the fact that it can be a pretty brutal system if you don't have the money to pay. Pay or die in some cases, you might put it, that patients are billed sometimes on a daily basis, and even if they're having life-saving treatment, if the bill isn't paid, it's out you go. Whether it's paid by the patient or by the insurance or by the hospital, how do doctors feel, how do they cope with that? And it also does reflect back again patients' attitude towards doctors and medical institutions in general. Is there any way that there could be some sort of a safety net for the worst, the cases that we see regularly where parents are pleading for the lives of their children or their parents and who are being told, you can't pay, don't come in?
I think it's really a tragedy that people cannot get the medical service they want. From the doctor's perspective, it's really heartbreaking for them to do this. The reason for this behavior is, let me get a scenario out, see what you will do given the scenario. Here's a patient who have no money, and once the patient get into a hospital, the government said, you take care of him. Then, after taking care of the patient left, government say, thank you, that's all. If this happens again and again, would you still treat the next patient who needs charity care as much as you started? Probably not, because it's like hospital is like human, it's blooding financially. It cannot go on forever.
But if you take the responsibility away from the doctor and onto the person who is actually causing that, which in this case is the government, whether it's local or central, which is not providing the money, do you feel the wrong people are being blamed by the patients in this case?
Definitely. It is a system issue. Now the way to solve this, I will be, first of all, getting more medical assistance in place. Second is, the public. I think on the flip side, there are some cases where the patients need this service for good reason. However, there are cases when the care the patient need is actually not cost effective. I think government now has been saying healthcare is great, we're going to offer to everyone, but the one message is missing, which is we have limited resources. You cannot take 2 glasses of water, you can only take up 1. Given the limited resources, we have to make some rational yet hard decisions. If government starts to make that statement, I hope the government emotion can change a little bit. However, from a political perspective, everybody knows making that statement is like committing political suicide. So everybody was promising benefits going to rise, you'll have better health care, without telling people we have limited resources.
Do you think that there is a special case to be made here because of the size of the country and the problems that it faces? Or are you optimistic that at some stage, whether it's in our children's time, that there will be some sort of effective healthcare system here in China that responds to the needs of the people?
Thank you. That's really a very tough question. From socially, economically, China is very difficult to consider China as a single identity. So is its healthcare. So in our lifetime, it is possible that Shanghai, Beijing may have a model that is somehow modeled after Europe or North America, while in some parts of the remote area or some of the rural area, we might have a model that's more like some other developing countries. I don't think a one model fits all statement is appropriate for China. And I would also argue that China has realized, many people in China has realized there are many mistakes already made in the mature market in healthcare that China can try to avoid. I don't know what the new model will be, but the new model will be very much take account into the fact that we don't have enough competent doctor, but we have some new technology with some lots of Chinese entrepreneurs who can solve the problems. And the government, I think the thing I like government policy is money is one thing, rule of game is another. We cannot keep injecting money if the system remains the old system. That's wasting money. So I think this additional funding should happen at the same time when the game when the game is changing. I'll be happy to use additional funding as an incentive or trigger to change the system, to be something different from American or kind of European or Japanese system.
A specific solution for China?
For China. But meanwhile, more using the funding as kind of incentive for new pilot. Hey, this city, would you like to try something? Here's the incentive. Because if you look at China's economy, we open up by having an experimental zone like Shenzhen. We call 特区, special zone. We sometimes think in healthcare, why not have 1 or 2 special zones? We can say people in Xinjiang, you can try something new. People in Chengdu, this is the budget, try something new, meet the basic healthcare outcome. We're happy with that. Then we can see which model fits China or which models fit parts of China. I think that's more realistic approach. It's more bottom up. It's more decentralized, but it's more system appropriate. While on the opposite is government say, this is one thing, I think this fits everybody. This reminds me of China 40 or 50 years ago, not the current China, I'm sorry to say.
Let's hope, Dr. Zhang, that for the sake of China's patients in the future and its doctors in the future, that perhaps one of those systems will work for this country. Thanks very much
definitely.
for coming on the level.
Pleasure. Thank you very much.
Thank you.